I'm here, by the way, this morning with obviously Dr. Marianne Gale, the Deputy Chief Health Officer, and also Dr. Matt O'Mara, who is the New South Wales Chief Paediatrician. I want to start by just announcing that our vaccination rates have come along extraordinarily well. First doses are now up to 83.6%. Second doses are sitting at 55.5%, which is quite a remarkable increase. Only 2 days ago, our first doses were sitting at 82.5, so that's about a percent increase since that time. So it's going up at about 0.5% each day for the first doses. And the second doses 2 days ago were sitting at 53%, so they're going up at about 1% a day for second doses. So that's quite remarkable. I want to thank everybody who's going out there and doing their bit for the community and for themselves and getting vaccinated, because that's certainly the way out of this pandemic. Tests last night to 8 p.m. There were 139,182 tests. Just want to thank everybody who went out and got tested, because the work that you do in going out and getting tested certainly empowers our doctors and our health staff to make the decisions on what we can and can't do as we move forward. Locally acquired cases to 8 p.m. last night were 1,063 cases. So 1,063 cases. There was one overseas case. Just want to highlight the fact that the community in Western Sydney and South West Sydney really are doing a very, very good job in terms of being vaccinated and just following the stay-at-home rules that have been in place. And I just make the point that the cases to 8 p.m. last night in Western Sydney were 220. I compare that back to 2 weeks. I picked the 11th of September as a date, and what I found was that there were 444 cases on the 11th of September. So to drop to 220 is actually a really positive indicator, and actually it's roughly consistent. The day after that, 444 was 402 cases. So to drop to 220 is very good. South West Sydney last night was up to 294 cases, and again, back at the 11th of September, was 490. So again, to the people of South West Sydney and Western Sydney, you're doing a great job getting vaccinated, complying with our stay-at-home rules, and you're making a difference to all of us. So thank you so much. Children, of course, 12 to 15, we opened up the vaccination opportunities now just over 9-10 days ago, and already 28% of children 12 to 15 are vaccinated. It's just amazing. So thank you to all the young people out there. We had a young person here the day before yesterday who was talking about the importance of vaccination, and I think all of her friends, her cohort across the state, are all doing that and getting out and getting vaccinated. And Dr. Matt O'Mara, the Chief Paediatrician, will make some comments about that. In regard to the current health impacts, I'll ask Dr. Gale to give the details of how many people in hospital and how many people in ICU and so on. But I do just want to say that, very sadly, we had 6 more people pass away to 8 p.m. last night. There were 4 females and 2 males, 4 ladies and 2 gentlemen, and they range in ages from 50 to 90, and obviously that's very sad for their families and for their friends. So again, my condolences on behalf of the government, but also on behalf of the health system, and I'm sure on behalf of our whole community, to each and every one of you who would be suffering that sadness that comes with one of our close friends or family members passing away. There have been, of course, stay-at-home lockdown arrangements in a number of regional areas. I just want to reiterate what was done yesterday, and that was that followed the press conferences I recollect yesterday. So yesterday, the areas that came out of the lockdown arrangements were Brewarrina, Gilgandra, Lismore and Albury. And there was also an announcement that Narromine will come out, subject to there being no other major problems between now and Saturday. So the folks of Narromine can know that if there are no major issues in their area, by Saturday night, midnight, they will also come out of that arrangement. And the other good news that I'm really pleased to be saying today, there's been no more major issues in either Orange or Glen Innes. So both Orange and Glen Innes will come out of the current arrangements, the lockdown arrangements. There'll still be the standard restrictions, of course, the precautionary measures, but they'll be out and back to much more normal life as of midnight tonight. I'm going to ask Dr. Gale to update us on some of the other medical issues, and also then Dr. Matt O'Mara, to talk to us a little bit more about the young people. And I think you might have something to say also just on the surge workforce that's people coming forward to put their names down and be able to assist us if needed, the doctors, the nurses, the allied health staff. So I'll start with Dr. Gale first, please.
Thank you very much, Minister, and good morning, everybody. In New South Wales, in the 24 hours till 8 p.m. last night, we had 1,063 locally acquired cases of COVID-19 and one case overseas acquired. We continue to see really good testing numbers with 139,162 COVID-19 tests reported till 8 p.m. last night. Currently in hospital, we have 1,244 people who are hospitalised with COVID-19. 233 people are in the intensive care unit, and 112 people are currently requiring ventilatory support. Of the 233 people in ICU, 179 are not vaccinated, 48 people have had their first dose of a COVID-19 vaccine, and 6 people have received 2 doses. As the Minister said, we're really pleased to see declining numbers in areas of Western Sydney and southwestern Sydney, and a big thank you from New South Wales Health to all the residents of those areas for following the public health advice, for getting vaccinated in the such large numbers that you have, and for getting tested promptly, and seeing those declining numbers is really reassuring. We continue to see, though, the main suburbs with numbers being Liverpool, Punchbowl, Cabramatta, Greenacre, Marylands, Guildford, Blacktown, Auburn, Yagoona and Lakemba. So for residents of those areas in particular, please keep doing the great job that you're doing. We want to see those numbers come down even further. So please, in particular, if you haven't booked in for a vaccination, please do so. We have lots of possibilities through New South Wales Hub clinics, as well as through GPs and as well as through pharmacies. So please book in for your appointments for vaccination. In terms of new sewage detections, today calling out for residents of the Grafton area in northern New South Wales, where we've had positive sewage detected, and we're not currently aware of any cases living in that catchment area. So if you live in the Grafton area, we particularly encourage you to be vigilant for symptoms. Please get tested, please get vaccinated. As the Minister said, tragically today we're reporting the deaths of 6 people who have lost their lives to COVID-19. They are a gentleman in his 80s from Western Sydney who passed away at Blacktown Hospital. He had underlying health conditions and was not vaccinated. A lady in her 70s from southwestern Sydney who died at Campbelltown Hospital. She was not vaccinated. A woman in her 50s from southwestern Sydney who passed away at Liverpool Hospital. She had some serious underlying health conditions and had received 2 doses of a COVID vaccine. A gentleman in his 60s from Western Sydney died at Nepean Hospital. He was not vaccinated and was otherwise in reasonably good health. A woman in her 90s from Dubbo died at the St Mary's Villa Aged Care Facility in Dubbo, where she acquired her infection. And this is the 4th death linked to the outbreak at this facility. She had received 1 dose of a COVID vaccine and had some significant underlying health conditions. And finally, a lady in her 80s from southwestern Sydney died at Liverpool Hospital. She was not vaccinated and had underlying health conditions. Since the 16th of June, we've had 266 COVID-19 deaths in New South Wales and 322 since the start of the pandemic. And on behalf of New South Wales Health, I offer my sincere condolences to all the families and friends of people who've lost their lives during this pandemic, and particularly to the family and friends of those 6 individuals who sadly passed away and whose deaths we are reporting today. So I'll leave my comments there and pass on to Dr. Mara.
Minister, Dr. Gale. Good morning. There's a few things I'd like to talk about today. One is the remarkable vaccination rate of 12 to 15-year-olds. As you've heard, now 28% of 12 to 15-year-olds in New South Wales are now vaccinated. They've had their first vaccine dose. That's over 110,000 children who've had that dose. And now they're on their way to being well protected against COVID-19. I think it reflects the trust they have that this is a safe and effective vaccine that's got minor side effects, and it's just like getting vaccinated as they normally do in their teenage years for tetanus and HPV. I'd encourage all families who haven't yet been vaccinated and their teenagers who are eligible but haven't yet been vaccinated to roll up, to go to your GP, to go to your local pharmacy to get vaccinated with one of the mRNA vaccines, Moderna or Pfizer. There isn't a vaccine yet available for children under 12 years of age, and trials are still going on to work out what the right dose is and what the right number of doses are. So until then, young children rely on their family to be protected against COVID-19. The best way of protecting a child from getting COVID is by having everyone in their family vaccinated. So making sure that everyone in your family who can get vaccinated does get vaccinated. I'd also like to talk about the enhancements we've got to our workforce. The national regulatory body, APRA, has now made it even easier for people to return to the workforce. So now 29,000 health practitioners are now automatically registered, and they can practice in the way they'd normally practice for another 12 months. So people who've stepped away from their clinical work can now come back into it. They can be doctors, nurses, midwives, pharmacists. The list has also been broadened, so it's optometrists, occupational therapists, physiotherapists, radiographers, podiatrists, psychologists. All of those people who have worked in the last 18 months can now get registered and be part of the workforce, not just as part of the direct COVID response, but working to the full extent of their registration. So APRA's enabled that to increase our workforce, which, as you'd expect, can become tired or unwell or need to look after family members. They've also been deployed into unusual models of care that we haven't done before, expanding virtual care, providing care in the community, expanding the critical care workforce. And so this is just a big bench of reserves that can now help support our healthcare system in New South Wales. Thank you.
Doctor, could I ask you quickly, just in relation to hesitant parents, obviously it's great that we've seen so many young children already coming forward for their first dose, but are you concerned that we will see pockets, certainly in perhaps northern New South Wales or other areas that have seen hesitancy in adults, that we might see pockets where children are unvaccinated, and what is your message to parents there?
Okay. There are always people who are uncertain about being vaccinated, who are concerned whether it's effective, whether it's safe, whether it's better than having the illness. I've got absolutely no doubt the vaccine is safe and effective and reliable, and the side effects are mild and transient. And while the illness in kids is usually mild, some of the teenagers and some kids with underlying medical problems can get a really severe illness, and they can die from it. So, on the balance, it's definitely better to have the vaccine. What people should do if they're not sure is to go to reliable sources of information or talk to trusted health professionals about their concerns so they can listen to them, they can understand what they're worried about, and explain, provide facts that may help influence their decisions that are in the child's and the family's best interest.
If we're waiting just to see the results of overseas trials for children 5 to 12 and what the vaccination can mean for them, How realistic do you think is it that we will have that age group being vaccinated before the end of the year, or should parents be expecting that their 5 to 12-year-olds won't be getting a jab until 2022?
I'm advised it's likely to be some months before those trials are complete. So we know what the best dose is, so we work out the best number of doses and work out what really is in the best interest of children. So that will take a while. So what can you do to protect your child before then is really do all those other measures, particularly getting other family members vaccinated.
Minister, can I just ask about staffing, if that's okay? New South Wales Health, via AusMat, has put in requests to Western Australia to come and assist in our staffing. That request has been out...
I'm sorry, who has?
Via AusMat, for expressing some interest with WA personnel.
I missed the first part. Is it New South Wales who had put in that request?
Health via
Oh, yeah, okay. Sorry, yep.
Apologies.
Okay.
You put that request out so far, so this is for doctors, nurses. So far, there's only been 2 personnel that have taken up that request. That's from the Department of Fire and Emergency Services in WA. It's clear that there's no appetite, either from Western Australia or from other states at the moment, to come and lend a hand for our staffing. Have you left it too late to put in additional staffing on the front line, given we're about to have an ICU crisis in about 3 weeks?
First of all, I'm not sure about what you've put as your premise. That's not something that Health has informed me of. But let me just say this, that if there were major concerns, they certainly haven't been raised with me. The health staff across New South Wales are working incredibly well. I was out a few weeks ago, or 2 weeks ago, in the far west and the west, and staff are working very well. In our metropolitan areas, they're working extremely well. And as Dr. Mara just said, we have an arrangement that was put in place at a federal level last year through the regulatory authority for effectively a reserve team of doctors, nurses and allied health staff to put themselves forward. And I think the number that I last saw anyway, was about 9,000 people had put themselves forward and can be called upon from time to time. So I don't think that what you're saying is actually a cause of concern. But sorry, can I just say, I'll happily find out for you. I don't actually know where you're from and I haven't seen you before, but after the press conference we can, I'll ask the health people to get some information for you. Sorry, Alex.
Do you want to follow up there?
Sure, if you want.
No, go on.
I mean, the fact that you've got this reserve workforce, isn't that an acknowledgement that you don't have sufficient staff in the system already?
We've said, Alex, seriously, we've been saying now for months that there's been a lot of work done. You've actually been at press conferences where we've had Dr. Nii Nguyen from the group that put together all the plans for the next year and a half, and that was last year. It's been modified, and they have put together a strategy that ensures that there'll be more than adequate staffing arrangements. So I don't think that we shouldn't diminish the fact that the hospital system, the state hospital system here and in Victoria, are both under pressure, as you'd expect, because we're in the middle of a pandemic. But the planning has been done. The clinicians have stood here before you and assured you that the work has been done. The clinicians are available. The system's in place. I remember last year when Victoria was having a challenging time. We sent more than 50 staff down there to assist at the front line. That's just the normal arrangements that occur. So, I mean, you can talk up whatever you want to talk up, but the reality is the system is working quite well. Any other? India? Yeah. Sorry, I'll come back to you if that's right. Yep.
There have been 6 separate exposure events at Liverpool Hospital this past week. Are you confident that the hospital's infection control measures are up to scratch, or does anything further need to happen?
Look, it's a pandemic. I did actually speak to the general manager, the chief executive there today again, and they're doing some investigations to try and work out what actually has occurred with the intrusion of the virus into the hospital. But I mean, almost every hospital in the world in the pandemic has had intrusions. It's just it's very hard to stop the Delta variant. But they're doing everything to try and work out what has caused the issue. And when they do, no doubt that will be addressed. Sorry. I'll come back to you, Ursula, if that's right. Yep.
Did he give any indication when you spoke to him this morning about...
It's a she.
Sorry, apologies.
about the impacts of how the hospital is operating at the moment?
Well, there didn't seem to be any major issues. What she was saying was that each of the patients who had been or tested positive are actually being managed in the hospital in the normal way. I think each one of them has been isolated within the ward. So it's a range of wards. It's an orthopaedic ward, a renal ward and a range of other wards. So the challenge is to try and work out why and how it got to just either one or two or a small number of patients in each of these wards. And they've done serology to try and track it, but they haven't got the results of that yet. So they'll work through that. And when they get those... Sorry, just let me finish, please. I mean, I've been doing this for 20 months. Just let me finish. So the reality is that when they get the results of that serology, they'll have some better ideas because they'll then perhaps be able to backtrack it to a source or an index case. And once they've got that, they'll make the announcements. It's not like any of this is ever not made public. Sorry. I'll come... Alex.
Well, you don't seem overly concerned about 6 separate wards. I mean, 24 patients at this stage.
We're in the middle of a pandemic, Alex.
People have got loved ones in the hospital. They'd be terrified.
Let me put it this way. I think that we should all be concerned whenever anybody gets COVID. It is a very, very dangerous virus. We need to make sure that we all go and get vaccinated. We need to make sure that we take every step we can to keep all of us safe. But worldwide, hospitals are places where people come in when they are sick with COVID. So there is always a risk. And the system is working as well as it can do at the present time to deal with each of these cases. What I was assured this morning was that none of those patients are in a situation which is they've deteriorated. None of them have gone to ICU. They are being managed. So at this point, yes, of course I'm concerned. I'm concerned every time. And I think it's very unfair for you to even suggest for 1 second that what I'm saying indicates that I'm not concerned. Of course I'm concerned. But I'm also concerned to make sure that the media doesn't overstate the case and actually put panic through the community when it's not necessary. Ursula.
On that though, it is Liverpool Hospital's now third major outbreak. I mean, we had 2 in August, 1 in the mental health unit, 1 in the actual wards. This is now another one that's gone. Is infection control enough? And how many staff have we seen furloughed as a result of this one?
How about we ask Dr. Gale, who's the Deputy Chief Health Officer, to answer that question from a clinical point of view, because I think I've given my perspective. But Dr. Gale, would you like to review it?
Thank you, Minister. So, as the Minister said, in the context of a pandemic, and we know that, from all the figures that we've seen and what we've been observing in recent weeks at southwestern Sydney, is one of the most affected areas, and Liverpool Hospital obviously being a major hospital in that area where sick people go for care. I know that our infection control staff, both at Liverpool Hospital but all across New South Wales, have been working incredibly hard, as have our infectious disease physician specialists, looking at infection control procedures, training staff, making sure all the equipment is available, the protocols are known, that everyone is regularly trained and updated about how to don, that is to put PPE on, and how to doff, that's to safely take it off. So there's been an enormous amount of work happening across the system, but the reality is that the Delta variant is very transmissible, and hospitals are always going to be a place at risk. And that's why it's really important for our community to really take up the message around getting vaccinated. We need to bring the case numbers down. We need a high coverage of vaccination to reduce the number of people needing hospitalisation when they are infected with COVID-19. At Liverpool Hospital, the uptake of vaccination amongst staff has been really phenomenal. I believe about 97% of the staff at Liverpool Hospital have received a first dose of COVID-19 vaccine or are fully vaccinated. So, it's a really high coverage amongst the staff there at Liverpool Hospital. And the teams are working incredibly hard. I'm aware that in the current outbreak, there are 24 patients affected, is our current understanding, and 5 staff. But as the Minister indicated, those investigations are underway to see what might be links between those patients, if at all, noting that we also have a high number of cases in the community, and we'd be happy to provide further updates in due course.
Do you know how many staff you've lost on that? How many staff are on furlough as a result?
I don't have those details exactly, but happy to provide an update.
And Dr. Gale, just while I've got you there, now that the case numbers are stabilising, it seems at this point, Is that allowing the contact tracers to kind of catch back up?
Yeah, look, thank you. Certainly having those case numbers stable is really helpful for us in contact tracing to, as you say, make sure and reinforce our efforts to get to people as quickly as we can. So we continue to send SMS messages as soon as we're aware of a positive case to let people know to stop and stay, that their result is positive, that they need to isolate at home, that they need to tell their household contacts. So we'll be continuing to do that, and we'll be continuing to interview cases who are at high risk, so might have been in a high risk setting like a hospital or like an aged care facility or like a school, and making sure we get to those people quickly. So certainly having the case number stabilised is helpful for us, because we can make sure that we really are getting to people as quickly as we possibly can, particularly those people who might have had some exposures or put others at risk in a high-risk setting like a hospital or like an aged care facility.
The Australian Health Practitioner Regulation Agency, that's obviously just a question for the minister.
Sorry. Just in terms of, we've seen this stabilisation case, we've been at about 1,000 for a little while. Is this the new normal? Are we going to stay at 1,000, and then go up and down? But is this our new baseline? Rather than, do we expect cases to ever come down past this?
Look, I'd love to say that I know that for sure. I'd love to say that I know what that number will be that we will settle on in New South Wales. Unfortunately, I don't. We always take on board the various models that experts around us produce. But what can change on a day-to-day basis, and it really depends on a whole range of factors. And as we've experienced throughout this pandemic, even a single event or a few single events can cause seeding and a number of other cases that flow from it. So things can change at any time. I'm hopeful that we will see a baseline lower than where we are, but at this time we just can't be sure. And the best thing that we can do to give us the best chance of proceeding with a low baseline is to really get our vaccination rates up as quick as we can, and across all the diversity of our communities, and that is in different geographical areas, in different parts of our community. That's the best thing that we can do, as well as to continue the public health advice and to continue to come forward for testing very promptly, even if you have mild symptoms. So that's the best thing we can do at this present time.
Dr. Gale, just based on the current vaccination rate, what is the date that you're working towards? Do you think we're going to hit 70% at October 8 or 9?
Again, I'd love to be able to give you a date. I don't have that. But look, we're hopeful that we just want to see those vaccination rates increase, both for second dose to get us to that double dose target, but also for first dose. If you haven't had a vaccine yet, we really want you to come out and get a vaccine. It's really important. Even one dose provides a high degree of coverage which protects you from infection, it protects you from severe disease, it protects you from hospitalisation, it protects you from death. So I particularly take today's opportunity to implore anyone out there who has not got any vaccine to please book in, please go to a pharmacy, please go to your GP, please come to one of our clinics, please get your first vaccine.
Dr. Gale, sorry, one more, sorry, Dr. Gale. Well, with the call-up of retirees and etc., where are the pinch points in the system currently? So we are heading towards those bigger numbers in the hospitals. Where are you now seeing the pinch points? Is it in the southwest and west, or is it all over? And is it particular specialties? What's the issue?
Look, I can't comment on that more broadly. I don't have oversight of all of those issues. But I think our health system continues to do everything we can to be prepared for any eventuality. And that's what we've been doing since the beginning of the pandemic, whether that's been around enhancing our public health workforce. And we've spoken before about how we've increased the numbers in our contact tracing teams, in our public health teams as part of the response. There's been big efforts across our ICU colleagues, in our nurses and in our specialists in ICU. We've had many staff pitch in vaccination clinics, a huge number of people changing what they would normally do every day to respond to this big demand for testing, for vaccination. We've also had a large number of staff become experts in COVID testing. I mean, that may never have been something that they thought that they would do in their career. So across the entire system in its breadth, people have adapted what they're doing. We have surged, we have grown, and we'll continue to do that to adapt to, whatever the future will hold.
Minister, if I could ask you a question, that'd be
Sure.
You mentioned how much the cases have fallen in Western and South West Sydney, and the vaccine rates there are very high, so it's good news. When are we going to get to a point when we can lift the permit system for the essential workers and scrap the areas of concern altogether?
Look, obviously those are issues at the Public Health Team, of which the Deputy Chief Health Officer is one of them. We'll give the government advice on, but at this stage we haven't reached that stage, and there's been no clarity given to the government at this point about that.
Mr. Hazzard, in terms of when we reach 70%, is there going to be any changes to how long a positive case has to isolate for, how long a business has to close down for, if there's been a side of concern? Have you got any idea of what that's going to be?
I think what we've said thankfully the last few weeks is really about, as we see us get closer to the double vaccinations of 70%, that there will be changes, and certainly there are discussions going on about how we deal with the quarantine arrangements. The quarantine arrangements at the moment are very onerous, and you'd know, because you've been to these conferences many times, you'd know that we're taking at the moment less people than we would like to in New South Wales, even though we're taking more than everybody else. We'd like to go back to having more numbers because there are many Australians overseas who'd like to get here. And so we have that trial, which was announced, I think, by the Premier a couple of days ago, of home quarantine. So hopefully, and that reflects that movement towards the 70% double dosage.
Sorry, just in terms of the question was more about, so when we get to 70, like say if I'm double vaccinated, we open up at 70% on the 11th of October. I go to a pub and there's an explosion.
Well, I haven't said we're opening up on the 11th of October, and we're not doing that. That's the media's assumption.
I go to a pub and I'm in close contact. Am I automatically going to be 14 days isolation if I'm double vaccinated?
No, I think that we're working through those issues at the moment with the Public Health Team. We're trying to work out exactly how that will be managed. But at this stage, what I would say is that, as Dr. Gale has said and as Dr. Amara has said, is we need people to go and get double vaccinated fast, as soon as possible.
Is there a consideration that self-isolation can shrink? It would have to be 14 days, it could be 7 days. And there's also a consideration that businesses won't have to shut down and do a deep cleaning.
What you're really asking is an epidemiological question. So why don't we go back to Dr. Gale? She's desperate to answer the questions. Dr. Gale?
Would you feel comfortable, for example, if people who had 2 vaccine doses had a deep close contact, would you feel comfortable if they were released after, say, 1 negative test?
Yeah, thank you. Look, we're looking at all those options, and we're looking at the experience from our colleagues overseas who have been living with the Delta variant for some time, and we're aware that different jurisdictions have made different decisions about exactly those sorts of issues. So we're currently reviewing all of that. We're looking at the latest evidence that continues to emerge from overseas, and we'll be making those recommendations about what sort of settings we think would be suitable, that would sufficiently balance the risks, noting that we have this wonderful increase in vaccination coverage and what that actually means from in terms of any potential changes from our traditional approaches to contact tracing. So we're working through those issues and we'll be providing advice in due course.
So it could be different per setting. So it could be different per setting. Say if you're outside, you wouldn't then have to isolate. That sort of thing. Yeah, all of those things are being factored in because we really have to measure our response and balance the risks, and that may take into account variables like, whether people were wearing masks, how far apart they were, how big was the space that they were in, whether they're vaccinated, whether the infected person was vaccinated, whether the uninfected person was vaccinated. So we're looking into the evidence around all of those sorts of variables to come up with what we think would be appropriate settings for us here in New South Wales.
Is the plan to introduce that, whatever you decide, if you're looking at the evidence now, is the plan to introduce that from 70%, or do you think that would come later?
So again, they're all issues we're looking into. So not only what we think the appropriate settings would be, but they may evolve with time as well. And so the question of what the settings will be, but also what's the appropriate time to make those sorts of changes are all things that we're considering at the moment.
Sorry, just before you do that, can I just say, I know you all want specifics, but you've been told now, and we've been told by our public health team many, many times, that it's not just the 70%. It depends on what the case numbers are. If the case numbers were still high, well, that presents challenges. But on top of that, all the sorts of issues that Dr. Gale was just talking about, they need almost an algorithm that would take into account all those issues to know what the risk factors are. It's since day one, since the 25th of January last year, it's been trying to work out the risk on the day in the circumstances, and it's very, very challenging. And can I also stress again that the public health team's role is to, the epidemiologists, they give the advice to government. Sometimes the advice is filtered before it gets to government by other parts of the health system. So, for example, we might talk to the paediatricians to look at how it affects children. We might talk to the psychiatrists, the psychologists. There are a whole lot of people who give us advice. And at the end of the day, then the government has to make the decision. But it is about making a decision. That's what government does. But it's often about, it's often in a very difficult situation. It's just not as easy as plucking an answer as sometimes I think some of you think. Come back to you in a sec. I'll just do it. Shall I come back to you next? Sorry.
The Prime Minister this morning said that New South Wales, that he was looking at going alone, if you like, with New South Wales and international borders, that they're currently in discussions with Gladys Berejiklian over this. Obviously, you may have not been privy to those discussions, but how would that work? Do they lift the international border for just New South Wales? And could that mean that we could all be flying overseas within a few weeks?
I think the way the New South Wales population is going and coming out and getting vaccinated, we are probably the preeminent state in terms of hopefulness to get out and get overseas, and I think the federal government understand that. Obviously we've had our challenges, but we've also always tried to be on the front foot, opening up, getting out there, letting our community get back to as close to normality as possible, and I'm quite sure those discussions will be productive with the Prime Minister. But the individual discussions I haven't been privy to, but the overall principle of getting New South Wales borders, international borders to match our state borders, and that is we keep our borders open. We want our borders open as soon as possible. So I trust in the fact that the discussions that will occur will see New South Wales well and truly lead the way. Sorry, yeah.
Thank you. The Australian Health Practitioner Regulation Agency.
Well done. I can never remember that. Well done. Yes. Yeah. AHPRA.
They're obviously the ones who create the sub-register.
Yeah, they do.
We know that list has been in place for 18 months.
They had a first go at it last year, and then a second go just more recently. Yeah.
So enlisting the help of either retired practitioners or people who have left the sector coming back in, they were initially enlisted to help with the vaccine rollout. It's the terms of their role which has now changed, so that's the new development.
That's true.
That means that they can now go back on the front line.
That's true.
Have you made the call too late to have retirees from the sector coming back onto the front line to help with the hospital system at the moment? No,
I think that the health system, you're asking the government minister, but it's actually the health system that are having those discussions with the regulatory body, which is the appropriate avenue. And there's been no indication to me of what you're putting. No, not at all.
Minister, can I just ask
Sorry, can I just go to Ingrid, please? Yep.
City of Sydney has decided to cancel the 9 p.m. fireworks on New Year's Eve. One epidemiologist we spoke to was saying that's an overkill because it's an outdoor event. Vaccination rates will be quite high then. What are your thoughts on that being cancelled?
Look, I'm not going to be criticising the council. I think it doesn't help to be critical. What I think is that the council has taken steps that it considers necessary, but I also am very aware that the state government and the Premier is looking at other options. After almost 2 years of a pandemic, I would excuse anybody for being a little cautious and careful. So I'm not going to be critical of the council. If that's what you wanted me to do, I won't do that.
Would restaurants and bars be expected to close too? Because isn't it more risky to be inside a restaurant than outside, fully vaccinated, watching fireworks?
Well, that's a separate issue, and by then we'll have gone past the 80% well and truly, and we'll have new settings for restaurants and cafes, and those are being worked through, as you just heard from Dr. Gale. Our first step is to get to what the settings are for 70%. I think it's all a little preemptive. What have we got? I think it's about 90 odd days to Christmas. I think everybody just needs to take a chill pill and let it work through.
But I think people are frustrated because it's 3 months away. And
I'm sorry, what was that?
I think people are frustrated because it's 3 months away and it's already been cancelled.
Yeah,
It sends a message like 3 months later we still won't even get outdoor events or a celebration.
If you want me to express outrage, I'm not going to do that. I'm just going to say to you again that I think that we're in the middle of a pandemic. The Lord Mayor and her council have made decisions which she thought was appropriate, but the government, with the benefit of the very expert advice of our public health physicians, Dr. Chant, Dr. Gale, their team, will work through those issues with the government and see what can be done.
Minister.
Yeah, Alex.
1 in 10 New South Wales residents aged 60 to 69 still haven't...
Sorry, Alex, you're very quiet today. What was that?
1 in 10 New South Wales residents aged 60 to 69 still hasn't been vaccinated. They don't have access to Pfizer here. Other states they do. Would you consider allowing that age group access to Pfizer?
Look, I think the challenge here is that it's the same challenge we've had all the way along, that the federal government have done their best to get as much Pfizer as possible, but there are limits, and we're not sure at this point with precision what amount of Pfizer will be coming to us even in a month's time. So we need to have real line of sight on that. But right now, the focus for the mRNA vaccines is obviously younger people, and we need to get younger people kept safe. To older people, and I'm one of those, I had AstraZeneca. The Premier had AstraZeneca. The Chief Health Officer had AstraZeneca. Many people have AstraZeneca. We have the world's best vaccines in New South Wales. Just go and get vaccinated. In our northern neighbours, in countries not very far away, people are climbing over each other to get at the vaccines, any vaccines. We're in a privileged position. Let's not be too precious about all this. Go and get vaccinated.
Minister, what is that, Minister? What's happened? What's happened?
Sorry, Lucy, and then I'll throw to you after Dr. Amari. Yeah.
Alex, just follow up.
Well, it's actually a slightly different question, but just one more was Queensland announced today it's got a plan to have internal Queensland-based cruises in the next couple of months. Is that something that would be our roadmap? Could we do something in our state with state-based cruises?
Look, we'll be looking at all that, but I mean, right now, Queensland's in a bit of a different position to us. They're obviously trying to get their vaccines up in an environment where I think the further north you go in their state, there's not a lot of awareness of even COVID from what I hear from friends up that way. So they're in a different position. We're in a different position. We're not going to take our advice or our enthusiasm for change from any other state. We'll do it because of the health advice we get from our Chief Health Officer and her team and the broader health team. So at this point, well, no, that's... Getting better at putting words in my mouth, Alex. The answer is it's up for obviously discussion, and I won't have words put in my mouth. But thank you for trying. Yes, Lucy.
Minister, just on vaccine supply, what's happened that has caused you to feel doubt about the supply in a month's time? Has something occurred that's thrown that schedule off?
Well, I think there are some issues just about how much we're actually getting, and we need some clarity around that. The last advice I had was that the health team is working with the federal authorities to make sure that we do get the supplies. But right now, what we do know is even if we get those supplies, answering Alex's or answering the question more broadly, is that the amount of supplies we've got are focused on the younger age groups and certainly not the older age groups. The older age groups should use AZ unless they have a medical reason for not having AstraZeneca.
Minister, I'm just hearing that there is an outbreak at the Mater Hospital, 14 people infected. Do you know anything about that or the circumstances at which that has developed?
I don't know the circumstances, private hospital, but I know they seem to be managing it quite well. But I'll ask Dr. Gale, do you have some information that you want to share on that?
Dr. Gale, can we just go through the wards that have been impacted? What do you know about it? When did it first happen? And if you're able to distinguish if it's staff or patients, please.
Sure. Look, I don't have all that detail for you, but I'm happy to provide that afterwards. The cases that we're aware of at the time of this press conference is of 11 confirmed cases, 4 patients and 6 staff members and 1 person who is a carer. It's our understanding that upon becoming aware of those cases that the Mater commenced testing of all patients and staff who might have been exposed, and I understand at this stage, no further cases have been identified, but you perhaps might be aware of a few more. So we'd be happy to provide an update around that situation in the matter.
When did you become aware of this, sorry? Of this incident?
Yes, look, I'm aware that the team knew of it yesterday, but I might be wrong in that, but happy to provide information after in the detail that you require.
With infections in hospitals, and you know people with other issues, not COVID-19, are going to delay going to hospital and get sicker at home and present with a rate?
Yes, look, one of the messages that we've been communicating consistently with the community is that if anybody is unwell at home and you think you might have COVID, please do get in touch with your health professional. Your GP is there available for you. There is a Health Direct line as well that you can call. And if you are concerned that it is a medical emergency, then I don't ask people not to hesitate to call 000 and you will receive assistance. Clearly, there are still people in the community that have all kinds of other health conditions that are not COVID. People who might still be having heart attacks, who have diabetes that needs care, who might be having strokes, who might be having all kinds of other illnesses that we would normally see on a day-to-day basis in health. And while our system is stretched, clearly, if you are out there in the community and you need assistance, the public health system is there and you will get care. We also will work very closely with our colleagues, and we do in general practice. So there are many supports available for people who need to seek healthcare, and I would encourage anybody, please don't delay. Talk to your GP, make a virtual appointment with your GP, go and see your GP, and if you're concerned it's a medical emergency, call 000.
Dr. Are you planning to notify the media of the outbreak at this hospital until we put it to you?
Look, again, I'm happy to provide details after this. I'm not aware of exactly the timeframes and exactly the details, but as I said, very happy to provide it to you after.
In terms of the same to what I was before, when you reached 78%, when those vaccination rates pick up, with schools, would we not have to lock down whole schools if there's an infection amongst a teacher or a child? Like classes get isolated? Would there be any changes around that?
Okay, so the decisions about schools, like in any other setting, are complicated. You know, what's in the best interests of all the children? You know, how to manage that? What's the benefits of continuing education? And so that will be a complex decision that considers many variables and will be made by the public health experts at the time.
But will we have to, I mean, it's a matter of just a lot of the adults at the school being vaccinated rather than a lot of the, 7% or 8% of children being vaccinated at school. Would, better vaccination rates among adults, would that change some of those procedures around isolation and lockdowns?
So the details of that, will be worked out. The principles, though, we know children are more likely to catch it from adults than to give it to adults, and they're less likely to catch it from each other. And so the risk to children's health is mainly from the adults around them. So whether it's in a household or a school setting or a sporting team, it's important particularly to have the adult people around them vaccinated.
Last question, please.
Minister, how about Dr. Gale? Wanted to see if there was any further updates on what would happen to staff who chose not to get vaccinated by the deadline. You were asked about it a little while ago and there was many firm plans at the time. Has there been any update on whether they'll be paid or would move to other areas of the hospital?
No, there hasn't been any decision taken on that at this point. But what I would say is, you heard a little earlier, Angela, that the numbers of staff at Liverpool, for example, 97% first dose. So what we're seeing is an incredibly positive response from health workers broadly across the state, and I'm heartened by that. So, I think at the end of the day, health workers know they have a responsibility to their colleagues, they know they have a responsibility to their patients, and therefore being vaccinated is an absolutely crucial aspect, and I reiterate that. I want to thank all the health staff, the work they're doing at the moment. Many of them have been on the front line for 20 months. It's been a gruelling 20 months. It's probably been a gruelling 20 months for the media as well, just the same issues day after day. But we are getting there, and it's a really positive time. It's a really positive part of the year. The best part about this is we're moving towards Christmas, and it looks as if we're all going to be able to effectively cut loose. There are going to be some restrictions, but we're going to be able to actually have a much better life in the next few weeks. So it's looking pretty good, and I think health staff are part and parcel of that arrangement. Could I just say, earlier on, I overlooked, I got the good news out about the areas that were coming out of lockdown, but I should have also said, and I apologise for this, that the current stay-at-home orders for Hilltop's local government area, which includes Young, by the way, the health advice is that that will need to be extended for a further 7 days from tomorrow. So I'm sorry to the community down there, but it's to keep you all safe. So yes, yes.
Sorry, can I just have one more? In relation to the regional areas, there are some, obviously, we know some areas that have very low vaccination rates out there. For one reason or another, they believe it's supply mostly rather than hesitancy. A lot of them are very concerned. When we get 70%, we're allowed to travel, that they're going to be hit with a wave of people who, while lesser chance of infecting them, no chance. Is there going to be, some of them calling for a regional plan, a separate regional plan to increase those vaccination rates on those areas? Can you give any more details about what?
Look, I've been talking to some of the regional MPs about that, and there is a concern. I mean, obviously, there is a concern about the hesitancy in some areas, but there's also, I think, a genuine concern that in some areas the vaccine supplies were not as good as they could have been, and we've known that right from the word go, that there was not all the vaccine that all of us would have liked all across this nation, but we have done our best with the supplies that we've got. The question, I guess, which we're struggling with is how do we manage those issues in terms of the areas that might have considerably less vaccine take-up. And there is no clarity around that yet. The health team, I can tell you, is working on that, though, as part of looking at how we open up once we get to the 70 and then 80% level, more broadly across the state. Because you could have, it's in a sense, it's a microcosm of what's happening with other states and territories. Places like WA have had almost no cases because they've just pulled up the gate across the Nullarbor Highway. There's a moat that goes to Tasmania. So, effectively, we've got to work out how we handle that, and we have our own small Tasmanias and WAs sitting within our own state, in a sense, populations that are the same. We've got to work through how we manage that. But what I would say in the short term, while we're trying to work that out, is please go and get vaccinated, because if we can all get vaccinated and get up to the 70 or 80% when we open up, then problem solved. If not, it's another issue that their public health team have to advise the government on, and they're doing that. We're looking at all sorts of options at the moment, but there's no clarity on that yet. Lucy, last question.
Just quickly on aged care, you talk about all the wonderful things we have to look forward to. Things aren't looking so rosy for aged care residents. They don't know when they're going to see their families again. Can you give us any clarity on when visits will be allowed?
Dr. Chant was asked that question yesterday. She expressed her ongoing concerns. Minister Colbeck, the federal minister, has been out today talking about the fact that he certainly wants to see everybody get back as soon as possible. Look, I have to say I think it's a really unfortunate and challenging and difficult situation that people who are living in aged care facilities who've gone there for good reason are not able to have their loved ones close by, to be able to hug them, to kiss them, to give them all the things that humans want. And it's certainly something which is top of mind for me as the Health Minister here in New South Wales. I feel it's a really sad situation, an awful situation. And so I think we need to actually get a set of strategies that work right down to the level almost of specifically what percentage of staff are vaccinated, what percentage of residents are vaccinated. One of the things that really bothers me is that, when we looked at thinking back to the Summer Hill aged care facility about 6 or 8 weeks ago, they had about 60-odd people in that facility, 60 residents, and about 10 of them were not vaccinated. And when I asked the questions as to why, I was hoping the answer would be, well, we've had new people come in and they just haven't had a chance to get the vaccines. But what I heard was that in some cases it was family members who had made the decision for them because the aged care residents may not have had full capacity to be able to make those decisions. I just think that if you've got an aged care relative, you've got a relative who's in an aged care facility and you're making those decisions, that's about as silly as it gets. You really got to make sure that those people get vaccinated because they deserve to have your comfort and not just your remote decisions about whether or not they should be vaccinated. So there's a lot of issues that have got to be done. Bottom line here is I'm strongly, as a health minister, strongly supportive of getting vaccinated. My final message today to everybody out there is don't listen to the social media. Seriously, there are some very strange dudes on social media with very strange ideas. You don't need to listen to them. Switch it off. Listen to the doctors. You just listen to Dr. Gale. Just listen to Dr. Murray. Listen to Dr. Chan almost every day. For heaven's sake, listen to the people who know what they're talking about and don't listen to those strange dudes on the social media. Thank you very much. Thank you.